We're right here in Louisiana. There's pollen all over our cars and on buildings, etc. And so that generates an allergic response for people with pre-existing allergies, even those without pre-existing allergies. Namely the watery eyes, itchy nose, runny nose, nasal congestion, headaches, even cough, an exacerbation of pre-existing sinusitis, bronchitis, etc. So that's something we see commonly even throughout the year in Louisiana, but especially during the spring and summer months. Typically, I can get somebody by or improve them dramatically just treating them symptomatically without formal allergy testing, because with an appropriate history, one can typically tease out what allergens are playing a role in a specific patient's symptoms. So a lot of people come in and say either I have migraines or I have sinus headaches or I have postnasal drip, and simply identifying what's the real trigger for their symptoms or the real cause of their symptoms, because missing that or missing the cause leads to inappropriate or inaccurate therapy. We offer in-office procedures, submucous resection of the turbinates, balloon sinuplasty, and in-office procedures like formal endoscopic functional sinus surgery. So balloon sinuplasty is I would say a relatively young procedure in terms of what all has been available for sinusitis from a surgical standpoint over the last 20 to 30 years. So it was developed approximately a decade ago. It's very popular because it's less invasive than traditional sinus surgery. You still hear people tell horror stories about sinus surgery performed many years ago simply because they didn't have the tools available that we do now, such as endoscopes and minimally invasive instruments that we use in sinus surgery. However, some people still don't like the idea of being put to sleep or having the more functional or formal functional endoscopic sinus surgery performed. So balloon sinuplasty's role is still to go into the sinuses, dilate up the natural opening through which the sinuses drain and become clogged, but in obviously a less invasive manner, which can frequently be performed in the office under just local anesthesia without any sort of general anesthetic whatsoever. So all of the sinuses essentially have natural holes called ostia through which the mucus that all of us produce every day drains. The issue with chronic rhinosinusitis is that those small holes, those ostia, get swollen shut from inflammation, recurrent bouts of infection, etc. And so with these small balloons, we can go through the natural openings of those sinuses and open them so that the infection or the mucus can be naturally expelled by the body. This is all we do, and so we're trained to tease those things out and treat those people appropriately. And I think it's very uncommon in our practice that we can't help somebody with those symptoms no matter what's causing it.